The WHO Malaria Focal Person, though positive in the next 6 years, the country could win the fight against malaria. He worries over the partial use of the interventions. Now take an example of the indoor residual spraying in the northern parts of the country. This has not been backed up by the use of mosquito nets or even some other interventions. Importantly, only 10 districts are being sprayed, yet this is a country which has 112 districts.
We need to make sure that the expansion, the districts which are benefiting from IRS are expanded from 10. And in the current malaria reduction strategy which has been written, the target of the government is to increase indoor residue spraying from 10 to about 50 districts. So when everybody sleeps under net and indoor residue spraying is expanded, everybody who gets fever seeks care in time. I think we shall be there.
Dr. Charles Katureebe, the WHO country advisor for malaria control, says that the presentation of the malaria burden has, however, been fictitious for so long. According to a guide used by most countries called the Health Management Information System, about 7,000 people in Uganda died of malaria in 2013. This is contrary to previous reports that put the figure at 320 malaria deaths a day, which translates to slightly over 100,000 people each year.
They used to quote 320 per day, but the problem is that the cases which are reported, some of them are due to fever. And you know that fever is not tantamount, is not equal to malaria. There are many causes of fever, you know.
Almost all infections, including urinary tract infections and typhoid, present with fever, and most kill fast. The 7,000 deaths translate to about 25 people dying each day in the country due to malaria.
That's quite interesting. It means what?
What it means, I think, is we need to report. The country needs to report confirmed cases, and that's why the WHO has come up to popularize or to advise the T3.
Test, treat, and track.
All cases should be first tested using either microscopy or rapid diagnostic tests. After testing and you have confirmed this is malaria, then you can go ahead and give a treatment. Then the reporting and tracking should track the cases which are confirmed cases of malaria.
Malaria is a disease which is reported to kill more people than any other disease in the country, including HIV.
Recently, the government has imported and has started procuring rapid diagnostic tests. Now you can get a test even at the community level. The community health worker should be able to test, should be able to test and see that this is malaria and treat from health center to up to hospital level.
We used to have a lot of death happening in this country. This is what we call the case fatality. Case fatality, by this I mean people who die from that particular disease. Okay, we used to have out of every 100 patients who would have malaria, 5 of them would die. But right now we are like having about 1% of these people dying.
Does this mean the disease is no more a burden?
I think it depends where we are coming from. These cases have been high. Uganda has been a high burden country for some time.
Yeah. We are making progress. For example, we used to test 25% of our patients used to be tested for malaria, but right now we're about 45% around that.
Dr. Myers says the country has progressed to about 40% in dealing with malaria, even though the set pre-elimination targets by the Global Malaria Fraternity will not be met. There is, however, an interesting measure which Uganda is yet to consider: mass treatment.
Is there a possibility of us treating so that the mosquitoes, when they come, there's no, parasite to carry?
Yeah, basically, that's the science which people have not picked up. And I think I'll not play my own trumpet. I did it in Katureebe. By, first of all, before you spray the house, you examine the people, you give them the medicine so that they sleep in a sprayed house when their blood is also clean. It took 8 months to get cases again. And Katureebe Church of Uganda Health Center 3 closed because there were no more malaria, because we treated all the parasites which were in people's blood.
However, as much as it's a recommended intervention, the WHO Malaria Focal Person in the country says it does not suit a country like Uganda, which has high transmission throughout the year.
It is only countries which have reached pre-elimination levels, where the cases of malaria are very, very low, that you can think of mass treatment and mass screening and treatment. So what Uganda has to do, we have to try to reduce the transmission of malaria, make sure that we scale up all the interventions as recommended, because it's a package.
Dr. Katureebe asserts that there is a need to scale up so that every Ugandan can benefit from the measures undertaken.
If you give treatment, if you give prevention to the under 5 and pregnant women alone, transmission will continue in the population to the people who are not protected.
According to Uganda's new malaria reduction strategic plan 2015 to 2020, all interventions are considered as a package to be administered alongside other measures.
And the government is saying we need to go multi-sector approach way, meaning that all sectors should come in, including the community, the donor community, and scale up for impact. So that by 2020, the malaria would be malaria death and malaria should be near zero.
2020 is just 6 years away. Florence Naluyimba, NTV.